When it comes to overall treatment, if I decide that yes, it is quite appropriate for us to look after this patient, I like topical treatments. I myself don't like to use antibiotics, and I don't like to use the pill unless that young lady needs it for other reasons, obviously contraceptive reasons, and the parents are happy with that. I would refer that patient back to their GP for proper follow-up. But given they're going to stay with me, we're going to go for just topical treatments. I'll use a good cleanser and scrub, a medical grade, not something that's usually available over the counter at a chemist, that would normally contain alpha hydroxy beta hydroxy acids. So it really cleans the skin and opens pores for great breathing of the skin. I'll often add in something called epiduo, which contains both benzoyl peroxide as an antiseptic to reduce bacterial content, and also adapalene, which in effect is like a superficial Roaccutane, so it's reducing sebum in the skin. With these treatments, you know, your good scrub and cleanser, and also the epiduo, you're getting a three-pronged effect to open pores, reduce bacterial count, reduce sebum production, and you tend to get a very marked effect on acne that's mild to moderate over a number of weeks. I do warn patients it's going to take some time. They're probably going to need to wait at least 6 weeks before they're really noticing a marked impact. I'll warn them as well that they may get side effects from the epiduo, and how to counter that if they are one of those patients with more sensitive skin, where they're getting redness, flaking, how to counter that, and give them a number so that they can contact us back. Actually, a lot of my patients, I share my own personal mobile number. They're welcome to send me photos so that I can just quickly respond with some advice. It takes me very little time. I sleep easy because I know that patients are going to be back in contact if they're concerned. And then at 6 weeks we'll review, and then I might step up the ante if I need to, or we might add in other treatments such as blue light, such as set of peels, such as a dermabrasion can be really, really effective. If I'm faced with someone who says, look, it's just not working, I'll go back through the history, make sure I haven't missed something. I'll go back through how they're using the treatments and make sure that it's optimal and they're applying it at the right time. Clearly, I'll consider a referral, especially if there's any cystic acne there, and might step up the ante with our add-in treatments for more moderate to severe acne. Of course, we would consider adding in a treatment such as an oral antibiotic or the pill. Yeah, I would need to consider that as well. Once we've cleared the acne, like over a space of months, if that person has got scarring, or indeed if they come to see me in the first place for acne scarring, we have some wonderful treatments available that really make a difference. So my own approach is to use multiple treatments, high strength targeted peel actually in the scars themselves that we apply with a toothpick into individual scars. Then we'll use microneedling with cosmeceuticals that are known to help with acne, such as a high grade vitamin B serum, for example. That would probably be my go-to with acne. And then we're also using red light, which is known to help with scarring, known to regenerate tissue, and also that will just soothe the skin following a treatment so that the patient goes out less red. And I find that combination of treatments given over time, say every 4 to 6 weeks, will massively improve scarring. Some people only need 2 treatments, some people may need 6, depending on their response and how bad the scars were in the first place. I've been very, very impressed with the cosmetic outcome for them.